Hi, my name is Sandy. I am a research fellow at the Black Dog Institute studying digital suicide prevention. So Black Dog Institute is the only research institute that studies mental health and suicide prevention across the lifespan. So our motto is better mental health, meaning we combine science, compassion, and action to be able to make that a reality. So unfortunately, of all the diseases, all the illnesses that we have right now, there are only two that's actually getting worse, meaning that we're passing on worse outcomes compared to the previous generation. The first one is obesity. The second one is mental health, meaning that mental health is a public and global health issue that we really need to address right now. One of the biggest challenges we have when it comes to suicide prevention is really understanding what works. There's probably no other medical issue that cuts to the heart of what it means to be a human being than suicide. Because we know it's not only about mental health. It's not only about whether a person seeks counseling or not. It's about whether a person has enough food on the table, they have a roof over their heads, whether they're financially secure. And so it's really challenging to bring all these factors together to be able to prevent suicide. Now, what are we doing about it? We're doing a lot of research. So for example, in my research, my philosophy is we need to meet them where they are. How do we reduce the number of steps a person needs to take in order to get the help that they need? So one of the things that has just happened is that Australia's just released their draft national strategy for suicide prevention. It's for consultation now. They're going to go away and they're going to rework it. But I believe it's groundbreaking and revolutionary in suicide prevention because we're not only working in healthcare, we're not only working in the public health sector where we're restricting means of suicide, that we're working together with media to make sure that news doesn't spread that can be harmful, but rather the Australian strategy, and I think the focus and future of suicide prevention is trying to prevent the onset of suicidal distress in the first place. As I mentioned before, it means making sure that people have the financial literacy to be able to avoid going into financial situations that can cause stress. It's making sure people have adequate work, making sure that people have adequate housing to prevent the onset of suicidal distress. And I think that's something we're going to be working on for quite some time, how we can pull everything together to make sure that we prevent suicide in the future. So one really important thing about suicide prevention and mental health is that what we think is the reality and what the data shows is often not really the same thing. If we went on just feeling, we think, all right, let's screen for suicide. A person has high risk, a person indicates that they need help, let's help them, and that's how we prevent suicide. Well, a study dating back from the 1980s by Alexei Pokorny and veterans in the US showed that, well, screening and risk estimation and assessment for suicide doesn't really work. He put people into two categories, high risk of suicide and low risk of suicide, based on all sorts of factors. More than half the people who died by suicide were in the low risk group. And so what it tells us is we needed the data and the research to tell us that that's not the optimal way forward. And so we look at coronial data, we look at census data, we look at data collected in studies, we even look at qualitative data of people's narrative stories to inform how do we prevent suicide effectively. There's a lot that I'm proud of, but for example, one of the work that I'm working on right now is we're using internet algorithms to be able to identify and reach those who are in need of help. That means that a lot of people, 50 to 60% of people actually don't seek help prior to a suicide, but what we know is that people will go in the privacy of their browsers and might type in suicide-related keywords indicating that they might need help. It's as simple as grabbing their attention and being able to show them that there are resources available, there is help available. I'd really like to take this time to share that suicide prevention is everyone's responsibility, meaning that one of the most effective ways to prevent suicides is to get a community involved, meaning that we ourselves turn to the person next to us and check if they're doing okay.